Welcome to the committee. Please state your name for the record and begin your testimony.
My name is Camille Kiefel, and I am president of Detrans Help, a nonprofit organization representing detransitioners. I've come here today as a detransitioner asking to pass the amendment for detransitioner coverage and to bring awareness to the difficulty we face getting access to proper medical care. Just like trans individuals, detransitioners have distinct healthcare needs. Because of the stigma around detransition, our needs are going unaddressed. While transitioning, we were treated with respect and sensitivity. When we detransitioned, we noticed a shift. Our providers became dismissive, and receiving the necessary care we need became difficult. We do not feel safe going back to our medical care providers who are not trained in how to care for us. There is no support for us. We reached out to WPATH and the WHO expressing our concerns. Our request for dialogue was met with silence. While trans individuals are on the boards of these organizations, there's not one detransitioner to represent our needs. The WHO, who manages the ICD-10 codes that are used for billing, there are no medical codes for detransition, but there is for transition. Because detransitioners do not fit the definition of gender variance, billing detransitioners under this puts providers at risk for medical fraud and erases detransitioners from being medically documented. The goal should always be to provide better health care, but detransitioner needs have been ignored and silenced. Many individuals who want to detransition can't because their insurance won't cover it. In one case, a detransitioner no longer identified as a woman. He had to wait 2 years to get his implants removed, and his provider billed it under medical fraud. Some detransitioners are forced to live as the sex they no longer identify with because they are unable to medically detransition. No one should be forced to live as the sex they don't identify with. It is crucial to understand that providing care for detransitioners does not detract from the care provided to transgender individuals. Detransitioners are a minority and need better access to medical care. Medical care should be within reach of everyone.
Thank you. And last, we have one testifier on Zoom.